Are you an EUTF retiree about to turn age 65? Then this video on Medicare Part B enrollment is for you. Topics for today will include the following. What is Medicare? Mandatory Medicare Part B enrollment and premium reimbursement. How do I enroll? And notifying the EUTF of Medicare Part B enrollment. What is Medicare? Medicare is a federal health insurance program for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease, or ESRD, also known as permanent kidney failure requiring dialysis or kidney transplant. Medicare benefits have 4 parts: Medicare Part A, hospital; Medicare Part B, medical; Medicare Part C, Medicare Advantage; and Medicare Part D, prescription drug. EUTF mandatory Medicare Part B enrollment. Retirees eligible for Medicare Part B must enroll in Medicare Part B when they become eligible in order to continue enrollment in the EUTF retiree medical and/or prescription drug plan. Covered dependents eligible for Medicare Part B must also enroll in Medicare Part B regardless of whether they are retired or actively employed if enrolled in EUTF retiree medical and/or prescription drug plans. You must provide the EUTF with proof of your Medicare Part B enrollment within 60 days of becoming eligible for Medicare Part B if you are enrolled in EUTF retiree medical and/or prescription drug plans. Failure to provide proof within 60 days shall result in the cancellation of you and/or your dependent's medical and prescription drug plan effective the first of the month you become Medicare Part B eligible. How do I enroll in Medicare Part B? Contact Social Security Administration to enroll in Medicare Part B. You can enroll in person, online, over the phone, or through the mail. If you are receiving Social Security benefits, which becomes possible from age 62, you will automatically be enrolled in Medicare's Parts A and B when you turn 65. If you're not collecting Social Security, you must take the initiative to enroll in Medicare. Medicare Part B enrollment for EUTF retirees turning age 65. Contact the Social Security Administration 3 months prior to your 65th birthday to initiate enrollment into Medicare Part B by way of Medicare's 7-month Initial Enrollment Period, or IEP. The 7-month initial enrollment period begins 3 months prior to the eligible individual turning age 65, the month they turn age 65, and 3 months following the month they turn age 65. Eligible individuals turning age 65 may enroll into Medicare during this 7-month window without having to worry about possibly receiving a late enrollment penalty from Social Security. Please keep in mind that eligible individuals may experience a delay in their coverage if enrolling during the month they turn 65 or following the month they turn 65. Please contact Social Security for more information on Medicare enrollment. Medicare Part B enrollment for EUTF retirees turning age 65. Once you have contacted Social Security and completed your Medicare Part B enrollment, you will need to notify EUTF and submit proof of your enrollment into Medicare Part B. EUTF will send out our mandatory Medicare Part B enrollment notice to retirees and their eligible spouse or partner 3 months prior to their 65th birthday as a reminder to enroll in Medicare Part B. This notice provides instructions on how to notify the EUTF on Medicare Part B enrollment and required document submissions through the EUTF member self-service portal. Retirees can follow the instructions under the "Here's what you need to do" heading on the notice. Medicare Part B premium reimbursement. Reimbursement eligibility for retirees. Quarterly Medicare Part B premium reimbursement is available for the following individuals: retirees hired prior to July 1, 2023, and their spouses or partner who are enrolled in Medicare Part B and are paying Medicare Part B premiums, including income-related monthly adjusted amount or IRMA, are eligible for Medicare Part B premium reimbursement, excluding penalties. Retirees hired on or after July 1, 2023, who are enrolled in Medicare Part B and are paying Medicare Part B premiums are eligible for Medicare Part B premium reimbursement, excluding penalties and IRMA. Spouses or partners are not eligible for reimbursement of their Medicare Part B premiums, and individuals ineligible for reimbursement. There will be no reimbursement for beneficiaries who do not pay a Medicare Part B premium, for example, enrolled in the Medicare Savings Program, Medicaid, or dependent children. Medicare Part B monthly premium rates for 2026. This chart illustrates the standard monthly Medicare Part B premium amount for this year, as well as Social Security's income-related monthly adjustment amount or IRMA for high-income Medicare beneficiaries who pay above the standard Part B premium. In order to determine the beneficiary's monthly Medicare Part B premium for a given year, Social Security does a 2-year look-back into the gross adjusted income taxes filed by the beneficiary. A beneficiary's monthly Part B premium will depend on whether they fall on this chart, with a majority of Medicare beneficiaries falling under the standard Part B premium, along with a small number of beneficiaries falling above the standard range. As part of your retirement benefits, retirees who pay a monthly Medicare Part B premium, and for those who qualify, their eligible spouse or partner, will receive 100% reimbursement of the Medicare Part B premium, whether they are paying the standard premium amount or if they are paying above the standard premium amount. Please note that Medicare Part B premium reimbursement is available whether or not the retiree enrolls in EUTF health plans and allow for 100% Medicare Part B premium reimbursement regardless of the retiree's employer contribution. Medicare Part B premium reimbursement. Retirees must submit proof of enrollment in Medicare Part B, direct deposit agreement form for Medicare Part B reimbursement, and proof of payment to the Social Security Administration or Centers for Medicare and Medicaid Services. Reimbursement will be effective the latter of effective date of Medicare Part B coverage or first day of the month EUTF receives proof of enrollment in Medicare Part B and a valid direct deposit agreement form. In addition, proof of payment to the Social Security Administration or Centers for Medicare and Medicaid Services is required to begin Medicare Part B reimbursement. Please keep in mind EUTF does not reimburse penalties or Medicare Part D premiums. Direct deposit agreement form for Medicare Part B reimbursement. Available on our website at eutf.hawaii.gov. Premiums are reimbursed quarterly and are direct deposited into the retiree's account. Complete direct deposit agreement form. For checking accounts, submit a voided check. For savings accounts, form must be signed by your bank. Medicare Part B premium proof of payment. Submit a copy of the Social Security Administration or SSA letter or billing invoice indicating your Medicare Part B premium amount. Medicare retirees and or dependents that pay a higher income-related monthly adjusted premium must submit a copy of their Social Security Administration or SSA letter to the EUTF each year. Medicare Part B monthly premium payment types. Types of Medicare Part B premium payment and required documents to submit to the EUTF annually for reimbursement. Standard monthly premium payment. If you are paying the standard monthly premium for Medicare Part B this year, you are not required to submit any additional documentation in order to receive reimbursement for paying the standard monthly premium. You do not have to do anything. Non-standard monthly premium payment. If you are paying less than the standard monthly premium, you must submit a copy of your Social Security Administration or SSA letter indicating your Medicare Part B premium to receive the correct reimbursement. Income-related monthly adjustment amount. If you are paying a Medicare Part B premium that is greater than the standard amount, you must provide EUTF with a copy of your SSA letter or Centers for Medicare and Medicaid Services (CMS) invoice indicating the higher Medicare Part B premium to receive the correct reimbursement. You have up to 2 years to submit a copy of your SSA letter or CMS invoice to receive proper reimbursement. Keep in mind, if the EUTF reimburses you an amount which is more than what you are paying, you will be subject to collection of the overpayment, and it may affect future reimbursement. Enrollment into EUTF Medicare Part C and Part D plans. EUTF Medicare Part C and Part D plan options requiring Medicare enrollment include EUTF Kaiser Senior Advantage Plan, Humana Group Medicare Advantage PPO Plan, and EUTF Silver Script Medicare Part D Prescription Drug Plan. Medicare requires that you are enrolled in only one Medicare Advantage Plan or Part C or Medicare Part D plan. If in the future you enroll in a non-EUTF Medicare Advantage or Medicare Part D plan, you may be disenrolled from EUTF's Kaiser Senior Advantage Plan, Humana Group Medicare Advantage Plan, and or Silver Script Medicare Part D Prescription Drug Plan. EUTF Medicare plan enrollment may take approximately 45 days for Medicare approval. For EUTF Silver Script Prescription Drug Plan enrollees, members will receive a temporary CVS prescription drug card upon initial enrollment to use until approval is finalized. A Silver Script prescription drug card will be issued to replace the CVS prescription drug card following Medicare approval. Notification online via EUTF member portal. Additional handouts are available to help retirees complete Medicare Part B enrollment through the member self-service portal. These handouts can be found on our website at eutf.hawaii.gov under the Learning Center tab, Retiree section. Uploading required documents through the member self-service portal. Please upload a copy of your and/or your dependent's Medicare card through the member self-service portal. Please keep in mind that the files cannot be password protected, as EUTF will be unable to open the file. Password protection files will be rejected. Submission of Medicare Part B reimbursement documents. For retirees and eligible spouse or partners who have completed Medicare Part B enrollment notifications through the member self-service portal, please submit the following Medicare Part B reimbursement documents by mail or hand-delivered to the EUTF address below within 60 days from the effective date of Medicare Part B. Medicare Part B reimbursement direct deposit agreement form and voided check if designating a checking account. Social Security Administration letter for you and/or your dependent indicating Medicare Part B premium amount. Our address at EUTF is EUTF 201 Merchant Street, Suite 1700, Honolulu, Hawaii 96813-2121. This concludes our presentation for today. We hope that the information that we provided has been informative and helpful. Mahalo from the EUTF for your time and attention.